Hello, Dr. Evangelos Milonas at Kinetic Health. Today we'll be demonstrating myofascial release exercises for the hamstring with a lacrosse ball, as well as some pin and stretch exercises. Now, before we get started, let's discuss a little bit about the anatomy. And we've got Mickey here to help, so we're going to have her turn around. And we're talking about the hamstrings, and that's the muscle group here on the back of the thigh. Now, these muscles come off the ischial tuberosity, which is the sit bone deep inside the glutes here. They come down and cross the knee joint, and they attach at various points. Now, the biggest of these is the semimembranosus, and that is a muscle that comes off the ischial tube. It comes down and crosses the knee and attaches into the medial tibia, but it also attaches into the medial meniscus, and it serves to function in that it helps prevent meniscal entrapment of that medial meniscus on the tibia. Now, the semitendinosus, which is another medial hamstring muscle, comes off the isch tube down, and it actually attaches further into the inside of the knee at a place called the pes anserinus, which is a common point of pain that we'll see in a lot of patients with medial knee pain. Now, the other muscles are the biceps femoris muscles, coming off the isch tube, down, crossing the knee, but laterally this time towards the head of the fibula, which is a bone on the side of the leg here, the lower leg. Okay, now what's important to understand as well is that the hamstrings are part of this superficial back line. It's part of that entire kinetic chain. And so the fascia that comes down from the low back, the erector spinae, into the ligaments here, the sacral ligaments, down into the ischial tube, through the hamstrings, into the calf, all the way down the Achilles tendon and even under the foot. So any restrictions in this area will cause an effect, a cascade above and below. So you can't separate this from the entire fascial line. It's an important concept to understand. Now, an important point to be made here is the antagonists to the hamstrings are the quadricep muscles. And those are the muscles on the front of the thigh that help you extend your knee and to some degree even flex the hip. Now, this is an important concept to understand because any restrictions in the hamstring on the opposite side will actually inhibit the muscles on the front. It's a term called reciprocal inhibition. So if we have a contracture or some type of restriction that's formed on the back, to your body and to your central nervous system and your brain, it says, hey, this is being pulled, it's being contracted. So what it does, it actually slows down the stimulation to the front here, making the quadriceps weak to some degree. So it's an important concept to understand because restrictions on the front can affect the back and vice versa. And it's a concept that we'll come across quite often.
Hello, Dr. Brian Abels from Kinetic Health. Let's go over a myofascial release of the hamstrings with the lacrosse ball. Now, you're going to need a hard chair. It's not going to work if you have a soft office chair and the ball sinks right into it. So, Mickey, why don't you take the lacrosse ball here and just put it right underneath and fairly close to the sit bone there. Pretty tender in there, isn't it?
Yeah.
Okay. So what we're going to do here is we're going to get warmed up first. Just moving around a little bit, not putting too much pressure on the area. Is that pretty intense in there?
Yes.
Really intense. Okay, why don't you move the ball a little bit forward there from that point there. Okay. A little bit easier there?
A lot easier.
All right, good, good. Okay, now you're going to find an area where you feel there's a restriction. And then you're going to put a little bit of compression on that area and kind of hold it for a second. Okay. You feel that there?
Yeah.
Yeah, it starts to increase quite a bit, doesn't it?
Yeah.
It does. Okay, when you held that for, maybe 10 seconds or so, you're going to start doing some shear work. But while you're holding that position, you want to make sure that you're taking deep, slow breaths. And this will relax all the muscles in the surrounding area. It will make you what we call parasympathetic dominant. You'll actually go out of stress reactions and muscles will start to relax. It's really a good way of getting things to release a little bit easier. You okay there?
Mm-hmm.
Starting to let go a little bit?
Yeah,
okay, good. Okay, now what you're going to do when you find that spot is you're going to start moving your knee back and forth. So you actually get sort of a cross fibrous action. The muscles of the hamstrings, the fibers run up and down like this. But when you're taking the lacrosse ball, you're going back and forth like this, and that's going to create a shear stress. So you're actually going to break up restrictions within the muscle itself. There's lots of great techniques that work at freeing up different layers of tissue if the hamstrings get adhered to other things in terms of superficial, intermediate, or deep layers, and they help to actually break up those layers. But when we're talking about specific areas of the muscle, we need to get that shear force in there. How's that feeling?
It's tender, but it's getting a lot easier now.
Yeah, okay. So what we do is you start up by, as Evangelist mentioned, the ischial tuberosity, slowly work your way down there. And the hamstrings are on the inside, the medial part, and the lateral part, the biceps and more. So that's going to be pretty tender on the outside there. Why don't you take the lacrosse ball and just take it up the outside there a little bit. So, okay. And maybe just kind of open up your stance a little bit there so that you can, good. Okay. Pretty tender there?
It's actually not that bad.
Not that bad there?
It's not
Okay,
too bad for me.
So again, back and forth to kind of warm it up, get in the area, and then when you feel like you've been on there for a short time, do a little compression and kind of hold it, deep breaths, maybe 3 to 5 breaths, and then we're going to do some cross fibrous work. We actually get in there and kind of go back and forth. Good. That feeling okay?
Mm-hmm.
Excellent. Okay, the next thing we're going to do is we're going to go over some pin and stretch exercises. When I say pin, we're going to use the ball underneath the hamstring here to find a position. First find a position where it's a little bit tender. Find one there?
Yeah, right there.
Yeah, right there, okay, good. Now, we're going to hold that position, and what I want you to do is I want you to take your leg and basically extend your foot out. Okay, do you feel the stretch on there?
Yes.
Okay, don't push it too far, and just hold it for a short time and go back again. So what we're going to do is we're going to do this dynamically about 5 times. Take it out there. Again, slow, deep breaths. How's that feeling?
That's tender when it's
Really,
stretched out.
really tender, okay. Don't push it too far at first there. Good. And back again. So after you've done about 5 repetitions, you're actually going to hold it out into almost a static position, using your breath and trying to focus on getting it to relax. Don't push yourself so hard that it's really sharp, acute pain. You want to give yourself a chance to adapt to this. Okay, bring your leg back again. After you did that, you find a new position where you feel a restriction, and again, you do dynamic pulses followed by a static stretch. But this is a really good way for releasing the hamstring muscles. Combine the two, get in there with the ball, do the myofascial release, do the pin and stretch. You're going to notice some really good changes in your hamstrings.